Health in infancy. Sometimes a mother is unable to produce breast milk because of trauma during and or after the birth of her baby. General anesthetics, blood loss, and other emotional and physical trauma can inhibit a mother's milk production. Good nutrition during the first 2 years of life greatly assists a child to reach its optimum growth and development. Breastfeeding greatly encourages good nutrition. However, not all mothers breastfeed their babies. There are a variety of reasons why they don't. They don't understand why breastfeeding is important to health. They don't know how to breastfeed. They don't have support from family and friends to assist them. Breastfeeding may be culturally undesirable. They are unable to continue breastfeeding because they must return to work. Alternatives in form of infant formula are readily available and promoted. An infant requires milk for the first few months of life because the digestive system has not matured sufficiently to cope with other types of foods. For this reason, breastfeeding is essential in both industrialized and developing countries. Then, when an infant is 4 to 6 months old, solids can be introduced into their diet. For example, in Australia, the incidence of breastfeeding is quite high, particularly among indigenous Australians and Torres Strait Islanders. However, the usage drops if the factors of lower socioeconomic status, lower education levels, or non-English speaking background are present. Women of the high socioeconomic groups are twice as likely to breastfeed for an extended period of time. Formula feeding is quite expensive and puts further demands on financial resources of low-income families. The benefits of breastfeeding have been promoted through a variety of activities funded by the Commonwealth Government, World Health Organization, and United Nations International Children's Fund. Launched the Baby Friendly Hospital Initiative in 1991 in an attempt to promote the 10 steps to successful breastfeeding. The steps included practices such as educating all mothers on the advantages of breast milk, ensuring that newborn babies were kept in the same room as their mothers, not using feeding bottles, and assisting mothers with any difficulties they may experience when attempting to breastfeed. They envisaged that this practice would be routine in all hospitals throughout the world by 1995. WHO and UNICEF also developed the code of marketing of breastfeeding substitutes as part of this strategy.